Welcome to another episode of Med Madness, where we break down complex medical topics into easy-to-understand segments. Today we'll be diving into alcohol-induced cardiomyopathy and cardiomyopathy due to viral myocarditis. These conditions are vital for medical students to understand due to their significant impact on patient health and the importance of early detection and management. Throughout this podcast, we'll cover the definitions, causes, pathophysiology, symptoms, diagnosis, and treatment options for these conditions, along with a real-world case study to tie it all together. First, let's talk about alcohol-induced cardiomyopathy. This is a type of heart muscle disease caused by long-term alcohol consumption. It results in weakened and dilated heart chambers, leading to heart failure. The common causes and risk factors include heavy and prolonged alcohol use. Typically, it involves consuming more than 80 grams of alcohol per day, equivalent to about 8 beers, for over 5 years. The pathophysiology of alcohol-induced cardiomyopathy involves ethanol and its metabolite acetaldehyde, which have direct toxic effects on myocardial mitochondria, causing contractile dysfunction. Over time, this leads to compensatory eccentric hypertrophy and dilated cardiomyopathy. Next, let's discuss cardiomyopathy due to viral myocarditis. This condition is caused by viral infections that inflame the heart muscle, leading to decreased heart function and potential heart failure. The common causes and risk factors include various viruses such as Coxsackie virus, adenovirus, and parvovirus B19. It often affects relatively young adults under 55 years old. The pathophysiology involves the viral infection invading cardiomyocytes, causing inflammation and contractile dysfunction. This leads to ventricular dilation and dilated cardiomyopathy. Now, let's move on to the symptoms and clinical presentation. For alcohol-induced cardiomyopathy, common symptoms include dyspnea, volume overload, and symptoms of heart failure with reduced ejection fraction. Patients often have a history of heavy alcohol use and present with symptoms such as dyspnea, orthopnea, and lower extremity swelling. For cardiomyopathy due to viral myocarditis, common symptoms include heart failure symptoms, chest pain, and ventricular arrhythmias. Patients might experience a viral prodrome, such as fever, malaise, and myalgia, followed by heart failure symptoms. Echocardiography often shows four-chamber dilation with diffuse hyperkinesis. Next, let's talk about the diagnosis. For alcohol-induced cardiomyopathy, diagnostic methods include clinical presentation and history of alcohol use. It's crucial to exclude other causes of heart failure with reduced ejection fraction, such as ischemic heart disease. Important clinical tests include elevated AST-ALT ratio, macrocytic anemia, and thrombocytopenia. For cardiomyopathy due to viral myocarditis, diagnostic methods involve clinical history, ECG showing non-specific ST segment changes, and echocardiography showing ventricular dilation. Imaging techniques include cardiac MRI with epicardial or mid-wall enhancement, and endomyocardial biopsy confirming lymphocytic infiltration and viral DNA or RNA. Moving on to management and treatment. For alcohol-induced cardiomyopathy, medical interventions include complete alcohol abstinence, which can reverse cardiomyopathy if done early. Standard treatment for heart failure with reduced ejection fraction includes ARNA and diuretics. Lifestyle modifications, such as abstaining from alcohol and maintaining a heart-healthy lifestyle, are also important. For cardiomyopathy due to viral myocarditis, treatment involves managing heart failure with reduced ejection fraction with diuretics, ACE inhibitors, and beta blockers. Severe cases might require a ventricular assist device or heart transplant. Preventive measures include early detection and management of viral infections and maintaining a healthy immune system. Let's illustrate these points with a brief case study. Consider John, a 45-year-old male with a history of heavy alcohol use for over a decade. He presents with dyspnea, orthopnea, and lower extremity swelling. Upon examination, he has bibacillar crackles, an S3 heart sound, and reduced left ventricular ejection fraction. His AST-ALT ratio is greater than 2:1, confirming heavy alcohol use. After ruling out ischemic heart disease, John is diagnosed with alcohol-induced cardiomyopathy. He is advised to completely abstain from alcohol and is started on ARNI and diuretics. Over the next few months, John's heart function improves significantly. due to his strict adherence to alcohol abstinence and medical therapy. In conclusion, alcohol-induced cardiomyopathy and cardiomyopathy due to viral myocarditis are serious conditions that can lead to significant morbidity and mortality if not diagnosed and managed early. Understanding these conditions, their causes, symptoms, and treatment options is crucial for medical students and healthcare professionals. Early diagnosis and appropriate management can significantly improve patient outcomes. Don't forget to engage with our pre- and post-podcast quizzes and Anki flashcards to reinforce your learning. Thank you for listening to Med Madness, and stay tuned for more insightful episodes.